Good morning, everyone. We are going to study about orthopedics. So this is workbook that I wrote about my experience, professional experience as medical interpreter in Japan, and I also worked in Australia. But today we are not going to do Japanese that much. We are actually going to focus on Serbian. And today I have a special guest. We have a medical doctor with us, Milica. So thank you so much for joining. If you have any comments at the end or questions, please welcome to say. Thank you so much. Okay, so let's get into it. So this workbook, I wrote a few topics, but today I'm just going to scroll down. We are going to talk about spinal canal stenosis. And in Serbian, it's stenosa kičmenog kanala. So the first situation or the first setting is it's similar to ER or emergency. Actually, this is more remote. So the patient was riding a bike and fell down with bike. So we have a doctor, a medical professionals, ER specialist riding on with a helicopter. So this is the situation, and I wrote this a bit later. So first question is any subjective symptoms. You can see in Serbian, subjective symptom. I feel numbness in both of my hands. So this word numb or numbness, no, numbness is more noun, numb is adjective. In Serbian, it's utrunmolost. And then the doctor makes the initial diagnosis. It seems that you have damage in your neck. We will take you to the well-equipped big hospital by this helicopter. So as I said, this is a helicopter scene. So they're going to take her to the hospital. Odvešćemo vas u dobro opremljenu veliku bolnicu. And the patient is a bit surprised, so really not in my hands, rukama. No, I don't think so. You should not move your neck. We will immobilize. Another word is secure or fix. So fix is actually more, means more when you actually make something better, improve something. But in this case, actually means to secure the neck. So the patient should not be moving the neck for now. And in Serbian, I just wrote immobilizirati for you. And then they arrived at the hospital. So this is at the ER or the emergency center, and they're going to run some initial screening tests. So we'll run a few tests, X-ray, MRI, and CT. X-ray in Serbian is rentgenski snimak. MRI is the same. Then after the test, orthopedic surgeon will talk to you about the injury. So orthopedics is orthopedski, and surgeon is chirurg. So that's a keyword, yeah. And then after the test, so judging from this is slightly direct translation. It's more like looking at the results, or the results show that something. The numbness in your hand seems to have been caused by the impact on your neck when you fell down. So this is pretty much what we discussed before. Utrnulost vaših ruku uzrokovana je udarcem u vrat kad ste pali. And then the doctor is showing some CT images. I'm sorry, I don't have the images right now, so please use your imagination. So look at the image. These are your cervical or neck vertebrae. Yeah. So usually we put C1, C2, C3. You can see that usually in anatomy, and usually medical students study this. So pogledajte snimak. These are so cervical neck vertebrae, vratni pršljenovi. And these are the neck part of the spine, and inside your spine there is a pipe called spinal canal, and it is a passageway for the spinal cord, and peripheral nerves are branched out or come out from the spinal cord. This is also an explanation. So the vratni dio kičme and kičmeni kanal. It prolazi kroz kičmenu moždinu, spinal cord. And then peripheral nerves, it's very similar. Periferni nervi granjaju se, znači branched out, ili izlaze iz kičmene moždine. So can you see this part of cervical vertebrae? This is pretty obvious. This part of your spinal canal is narrowed. So it's narrowed. It's a little bit smaller hole. It's not as wide. And this is why it compressed the spinal cord. And this is, so it's sužen, not narrowly sužen, it komprimira kičmenu moždinu. And then the peripheral nerves that control your hands originate and come out from here. And peripheral nervi kontrolišu vaše ruke, nastaju ili izlaze ovdje. And this is where the patient is feeling that they understand about their condition, so they're confirming, they're asking a question to confirm, so this is why I feel numbness, utrunost, and exactly baš tako you have spinal canal stenosis, znači stenozu kičmenog kanala, and because of that you are prone to numbness, so prone to skloni ste something. Yet more easily than other people without stenosis. I see, what should I do? Nešto da radim. And then the patient will stay at a hospital. You'll stay here tonight, and then you can book a flight home. You can leave the hospital, and the patient will then go ahead and make the booking. And then for the time being, they need to wear something. So you should not move your neck, as we said. I will immobilize or secure your neck with a collar called Philadelphia collar. So this is more like Victorian fashion. I'm not sure if you watched any movies, classical movies. So it's kragna, yeah? We're going to immobilize the neck, immobilizirati, osigurati sa kragnom, koja se zove Philadelphia kragna. Should I keep wearing this collar after the hospital? Then when you leave the hospital, you'll get a simpler, softer color. So they'll give them something similar, nešto jednostavnije. I'm glad to hear that this color looks quite excessive. I feel rather embarrassed to walk around wearing it. This is more how patient feels. They feel a little bit embarrassed. Znači malo im je neprijatno da hodaju sa tom velikom kragnom. Yeah? Then they're going to get some data. So I'll give you CD-ROM with all the examination data or data. So please take it to your local hospital once you get both. Okay, thank you. And then before leaving the hospital, this is more with the technicians. So we all have the size of our necks are different. So they're going to actually measure the size and make the color that fits properly for the patient. Yep. And the color technician will take the size, measure your neck, will pass you size that fits you. Okay, that's pretty straightforward. And this color should fit your neck. I'm going to show you how to use it. Znači pokazat ću kako da koristite. I see now how to use it. Thank you. I put this IC resume. It's more like, okay, it's a patient making a confirmation on their understanding on the procedures or treatment. And then the cost. So this is, as I said, it's based on Japan, on Japanese medical setting, or shall I say health setting. So each country has a different setting. I know in the United States, there's a lot of private insurance companies. In Australia, it's more similar to the UK, it's more national. In Serbia, it's more national insurance, but there are some private firms as well. So this patient is going to use national insurance, but the procedure or the process of the payment is not exactly the same as usual. So let me explain about the costs, znači troškovi. It will be covered by national health insurance. So this nacionalno zdravstveno osiguranje is Serbian. So however, the process is not the same as the usual medical treatment fee. You must pay the entire amount from your pocket upfront. So I'll just say the last sentence because this obviously has an impact on the patient. So ceo iznos morate platiti unaprijed iz svog džepa. That means 100%, yeah? So once you get home, you'll need to contact your local healthcare insurance office. And then she says, I understand. And we'll give you the receipt and certificate that you'll need in order to claim back your money. The receipt je priznanica ili potvrda, tako, certificate, priznanica, potvrda. So vi ćemo vam dati sve te dokumentaciju da biste povratili svoj novac. And then you'll need to fill out, this is the paperwork procedure, bureaucratia, yeah? You'll need to fill out the form they'll send you and then send it back to the office with the required additional documents, znači with sitting potrebnom dokumentacijom. Then they'll pay you back or reimburse. This is more, register is rather high, it's more proper word to say reimburse when you pay back. That's covered by the health insurance. Znači, nadoknaditi ćemo vam iznos pokriven zdravstvenim osiguranjem. It sounds a bit troublesome, but I'll follow instructions. Znači, malo je neproblematično, nego time consuming. Čini treba dosta vremena oko toga da se to sredi, ali hvala na upustima and thank you. Okay, and that's pretty much it. So I hope this is more my Japanese experience, as I said, but I think it can be used in healthcare professionals in Serbia and also in diaspora in the States or Dubai or wherever Serbian people live. And I hope it's going to help someone. Okay, so Milica, could you tell us if you have any comments or questions or whatever?
I think that this is a great learning experience, especially for learning foreign language, especially medical terms. So I'm glad that I am here.
Thank you so much. Yes. Okay, thank you so much. Yes, I hope it's going to help someone. And yes, if anyone wants the actual script, if you email me, I'll put on YouTube. If you email me, I'm happy to share the script for you, of course, free of charge. So thank you very much for listening. And as soon as I translate some more scripts, I hope to upload some more. So thank you for your time, Milica. Thank you, everyone.
Thank you.
Thank you.